You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the MaternalRx podcast. I'm your host, Dr. Danielle Plummer, pharmacist, antepartum doula, and a mom on a mission to improve women's health care. Today, we are so excited to have an amazing interview with Dr. Jennifer Winston, who has a report that everybody needs to see these results too, announcing the 2025 Best Hospitals for Maternity Care. But before we get into today's interview, I just want to mention that in this series, we're tackling one of the most urgent public health crises in our time, maternal morbidity and mortality. Pharmacists are uniquely positioned to bridge this gap. My goal is to empower you with the knowledge and tools to make that difference. So I want everyone listening in our healthcare community, pharmacists, and all the collaborative practitioners to change the narrative and save lives. One last thing before we get started, just my disclaimer here, views and opinions expressed on this podcast are my own, do not represent the opinions of my employers. This content is for informational purposes only and should not be taken as medical advice. So that aside, let's get into today's interview. We're not only discussing the recently released U.S. News World and Report 2025 Best Hospitals in Maternity Care, but we're hearing straight from the health data scientist who led the analysis this year and last year for Best Hospitals in Maternity Care, and also list the Maternity Care Access Hospitals, Dr. Jennifer Winston. So I stole your bio from the website. Okay, I'm going to go ahead and read what I learned about you prior to meeting you today, and then I will let you add whatever you like to it and get going because I have so many questions for you. So Dr. Winston is a health data scientist at U.S. News and World Report, where she leads survey development, data collection, and analysis for best hospitals for maternity care. She also contributes to U.S. News Health Equity Ratings and Best Children's Hospitals rankings. She holds a PhD in medical geography from the University of North Carolina at Chapel Hill and a master's in international environmental policy from the Middlebury Institute of International Affairs. She has over 10 years of research experience focusing on maternal and child health and access to health care and has been with U.S. News since 2022. So Jennifer, why I'm so excited to have you here is because as a pharmacist, we talk about results in studies and trials and publications all the time, but it's a rare treat to be able to actually speak firsthand to the person who did this research. So thank you so much for taking time out today and come on to talk to us about this. I have so many questions for you. Is there anything you'd like to start with?
Well, just as in, thank you for having me for starters. It's a pleasure to talk to people about the research that we're doing. We're very excited to be presenting it. As you alluded to, we just released our Best Hospitals for Maternity Care for 2025, and those ratings are really intended to help pregnant people in consultation with their doctors make decisions about where the best place for them to receive their maternity care is. And so we're really excited to be able to put that information out in the world.
Thank you for doing this. In my experience in maternal health, I see such a disconnect because I'm working with the top doctors and it's incredible. And I'm going to these conferences where they're talking the latest, the greatest research, the best outcomes. But then on the same hand, or on the opposite hand, actually, I'm getting messages from women going, my doctor's not listening to me. I didn't have the outcome I wanted. And then when we read these statistics in the United States that are so horrific that our government created a task force and gave funding to many states, it's not all 52, but most states, to figure out why are women dying in childbirth or the year following in the United States today. And there's many reasons. It's multifactorial. So to have data like this is just so important. So now we can go, okay, these are the hospitals that are making progress in the right direction. They're the top of your list. Let's get the others to follow suit and learn what they're doing from those. So my first question for you is, how does U.S. News determine the best hospitals for maternity care?
Yeah, so we conduct a survey every summer that is open to every hospital in the United States providing maternity care. And that survey asks questions about a hospital's C-section rates, its severe unexpected newborn complications rates, and as you were alluding to, whether they implement best practices for both exclusive breast milk feeding and reducing maternal morbidity. And so we take all of that data and then we create a composite score that looks at how well hospitals are doing across all of the indicators. And then we use those to identify what we call best hospitals for maternity care. And so we're really excited. The program has grown every year since we began it 4 years ago. And so we had a 20% increase this year in hospitals who provided their information so that we can then turn around and provide it to the public. And of those, we rated 414 of them as best hospitals for maternity care. So we're really pleased to make that announcement.
That is incredible that the numbers, and as more systems learn about this, they want to be part of it, I would hope. The number I see is that 817 participated this year, and they submitted that data that was needed for evaluation. So much to unpack from this and from the data and improve these maternal morbidity and mortality rates. So how should expectant parents read the latest ratings from U.S. News? Like, what should they keep in mind when deciding where to have their baby?
So again, all of the data that we provide is information that pregnant people should use in conjunction with their doctors in picking the hospital that works best for them. But the great thing about the data that we provide on hospital profile pages is, in addition to their rating, whether they were rated as a high performer or a best hospital for maternity care or not, we also provide other metrics. We provide the individual quality metrics that hospitals are providing. So patients can see how a hospital is doing specifically on their C-section rate or on their severe unexpected newborn complications rate. So if there's an individual metric that's important to the patient, they can look at that metric specifically. And then we also provide information about services that a hospital provides. And so do they have doulas? Do they work with midwives? Do they provide perinatal and postpartum depression screening and services? And so if there's additional services that a patient is interested in, they can check out those information on our website as well.
Those additional services are really vital to the outcomes. A lot of times, like I mentioned, where the doctor is going to say, oh, we saved this baby that was at risk of not making it. This is amazing. But from the mom's perspective, I almost lost my baby. And somebody like a doula can step in there and help bridge that gap. Pharmacists too are not some hospitals now have pharmacists up on the maternal floor. They're bridging the gap from that mom delivering the baby over to that baby going to the NICU if there are those severe complications, and helping that mom in their mental health connect with the right provider to handle those other issues outside of medication safety and outside of what their OBGYN would be handling as well. So what are some of the themes among the data from the hospitals rated best for maternity care by U.S. News, as well as themes among the 2025 maternity care access hospitals? And access hospitals, first, I want to start there. Let's have you define, what is an access hospital?
Yeah, so I'm particularly excited about the maternity care access hospitals. As you probably know, the maternity care desert problem is a huge problem throughout the United States. March of Dimes has done a really great job of raising awareness about the problem. But in their most recent report, they highlighted that there are over 2 million women of reproductive age living in a maternity care desert, and that affects 1/3 of counties throughout the United States. So it's a staggering number of women who don't have access to maternity care in their community. And so as you know, that affects their ability to seek the prenatal and postnatal care that is so important to maternal and child outcomes. So the maternity care access hospitals are hospitals that we recognize as sort of the last bulwark against their community becoming a maternity care desert. And so they are the only hospital that's providing maternity care to their community. And they also meet our quality requirements for the designation. So they're providing good, solid care to a community that wouldn't otherwise have access. So we're really happy to be able to recognize those hospitals as part of our larger commitment to equity.
This is really profound, and the outcomes go for generations, right? Because that baby now is starting off life with better circumstances. And I had learned in the past that maternity desert is a county that does not have an obstetrician there. But now I'm learning that they also don't have a hospital there that is set up for deliveries like we're talking about. So where does the mom go? Like, it's a rhetorical question. Like, what do you do? Where do you go, right? If you don't have an obstetrician and you don't have a hospital deliver in your county, you're going to be having a long trip. And we know maternal health doesn't work that way. Labor delivery doesn't work that way. You can't plan, oh, I need to drive 3 hours or 5 hours or go to another state for the care to deliver this baby. And we have a lot of places in the United States where you actually have to get a helicopter to go. I think about our women up in Alaska and Hawaii, and we do have great hospitals there as well, but they might be living far away from those hospitals. So much work to be done in these desert areas, and the fact that you are in here digging out that data and reporting on it is really, really powerful. So we just talked about what are maternity care access hospitals. How are they different from the best hospitals for maternity care according to your study?
So it's a separate designation. The maternity care access hospitals need to meet both geographic and quality standards. And the best hospitals for maternity care really focuses on the high benchmarks that we've set for quality. So there are hospitals that meet both designations, and then we also have hospitals that meet one designation or the other, depending on where they're located and the quality of care that they provide.
And is that something that you can see when you go to the website health.usnews.com for that data?
Absolutely. We have a list of the best hospitals for maternity care. And then if you click on a hospital's profile page, or you go to the hospital located in your community, you can see whether they've received either or both of those designations.
Amazing. Amazing. Thank you again for sharing this data. You mentioned it is the 4th year of doing the study. You did last year and this year. What's new in the 2025 study?
So one of the things that's new this year is that we've added a new measure of representation of labor and delivery by race and ethnicity. So patients, in addition to the other quality metrics that we provide, can look at how the distribution of babies delivered at a hospital is either similar or dissimilar to that of the larger community by both race and ethnicity. And so that can be an indicator of how well the hospital is really serving their community's needs, and can be something that patients may want to use in conjunction with the other quality metrics that we provide.
Absolutely. And I want to give a shout out to Dr. Karen Florio, whose session I attended. She is an MFM and presented on a lot of data from the Southeast in maternal health, and had said we need to stop othering people. We want to break down these different races, ethnicities, and get that granular data. And my regular work that I do, I'm often up in Alaska, and they want data from their Pacific Islanders, might be different from other Pacific Islanders. We want to break it down. We now have DNA that we can analyze, and I'm looking forward to what we have with AI and genetics, pharmacogenetics, personalized medicine, to go, okay, we can say this is your race, this is your ethnicity, base it on that, and not just check a box because I think that's what I am or what I've been told. So, and I've had that happen. A good friend of mine from many years ago thought she was one I guess, race, and then found out, well, her dad actually was of a different one. And, that will change outcomes as well. Sometimes what we see with people isn't actually what's in their DNA, or what we think we see, I should say. So having this data and seeing where it's going, and the fact you're reporting on this and pulling that information is so, so exciting. What should communities be proud of? The ones that are recognized hospitals in their area, why should they be proud?
So what we have consistently seen, and seen again this year, is that hospitals that we recognize as best hospitals for maternity care really are, on average, providing better care on all of the metrics that we collect data on. So recognized hospitals have a 22% lower C-section rate, and it's a 44% lower severe unexpected newborn complications rate. So that's a pretty dramatic difference between hospitals that we recognized and didn't recognize. They're also much more likely to be implementing the best practices that you might expect for both exclusive breast milk feeding and reduction of maternal morbidity. And also, sort of related to what we were talking about earlier, we ask hospitals to report their disparities on outcomes by race and ethnicity. And so while we don't necessarily publicly report those data, the fact that they're transparent about that and collecting that data, that's the first step towards sort of bridging that gap to reduce disparities by race and ethnicity.
And I want to go back to something you said. C-section rates 22% lower compared with maternity care hospitals not recognized by U.S. News. 22%, when you compare that to an actual number of women, the long-term effects, C-sections have become normalized. It's still an invasive surgery. We're cutting through many layers of tissues. It can lead to other negative outcomes later in life. Not to scare anybody, this becomes very routine in our society. There are many reasons where that benefit outweighs the risk of not doing a C-section. And that's where, like you mentioned, this is up to the mom and the family and their provider and what's best based on where they live, what hospitals are nearby. And if you're near one of these that are rated, you're going to have a 22% lower chance than the ones that have not been recognized by your survey. I have a lot of statistics here I would love to share. We shared some of them, but I'm going to just back up a little bit. So best hospitals for maternity care are 47% more likely to be designated as baby friendly, indicating a hospital has taken important steps to support breastfeeding. So this is a very interesting one for me, given the age I am. My parents' generation, my mom, my aunts, they were all taught, formula is just as good as breast milk. And then when I came around and had my children, it was a complete opposite. Breast is best. We know we get the immunity from the mom. There's a skin-to-skin contact that gives that baby security. There's so many reasons. And then we have a society of moms now, given our economy, you have to have two incomes, or most of us have to be able to live a comfortable life in the United States. And it's become a challenge. Moms, I love the fact we have a choice now, but it also adds another burden because then moms tend to feel mom guilt regardless of which choice they make. And it's such a personal decision. Do I work? Do I stay home? Can I do something part-time? How does that affect my long-term income? Either way. And breastfeeding is not necessarily easy. It's natural, but it's not easy. And I love the fact we have lactation consultants that are now being covered by insurance companies to help that mom get through that transition. When you're working full time and you're pumping, and not all jobs are conducive to allowing that time to go pump, or if you're working with the public or on your feet all day long and you're not hydrated enough, it's a challenge. So when you have that support, when you can get a mom off to a strong start breastfeeding when they leave the hospital, there are better odds than continuing through that first year. That's most important for that, to get that baby off to the best start. So thank you for recognizing which hospitals are doing this.
And the one thing I will say about that is in past years, we've only looked at a hospital's actual exclusive human milk feeding rates in our quality metrics. But this year we expanded it to include whether hospitals really implementing these best practices to promote breastfeeding for all of the reasons that you mentioned, that for some women, breast milk feeding is just not something that's going to work for them for a variety of reasons. And so what we're looking for hospitals is to sort of facilitate and promote breast milk feeding to the extent that they can and implement these best practices, but also recognizing that for some women, it's just not something that is going to work for them and their family.
Absolutely. So thank you for recognizing both and putting that data out there. And I hadn't heard of Baby Friendly USA, so I want to give a shout out to that organization as well. Another statistic you published on was we talked about severe unexpected newborn complications. These hospitals are 44% lower compared to the ones not recognized by U.S. News. Yeah. That is an astronomical number when you compare it to your N in the study, right? How many women, I mean, the outcomes for that baby, and coming from hospital pharmacy, we have these babies in the NICU, they're on TPNs, the cost, that mom goes into the hospital thinking they're going home with their baby. And when they're not there, they have these severe complications. They can stay in the NICU for many, many months, even. What it does to that family, the mental health of the family, if they have other siblings that need that mom there, dad there, their family members, 44% lower is huge. Any insight you can add to how or why?
I think it's a variety of things that these hospitals are doing right. It's the balance against reducing C-section rates, but also doing it in a way that makes sure that babies are still safe, to try and keep these severe unexpected newborn complications rates low. But as you said, it's obviously one of the very most important metrics for maternal and child health, so we rate it really heavily in our composite scoring. That and C-section rates are really the two most heavily weighted components of our identification of who's the best hospital for maternity care. So
important. Leading into your next bullet point here, episiotomy rates. So this concept is a little bit mind-blowing to me. On one hand, it's very simple. I understand, right? We all understand what the purpose of the episiotomy. But when you look at the history behind it, when doctors started doing it, what the outcomes are, I told you I became a certified antepartum doula. If there's better techniques, there are times, again, just like C-sections, maybe that is the best outcome for the mom, especially you're in these maternal deserts. You don't have these highly skilled, because maybe you don't have midwives or anyone else near you that can give other insights on what, working with that care team. But your data showed that the hospitals that were rated were 33% lower than the ones not recognized by U.S. News and episiotomy rates. That's a third? That tells us a lot. That tells us a whole lot. Like, do these other third need to be cutting that woman in such a manner that it might not be necessary to do so? And again, recovering from that, not fun at all, right? And not necessarily how you want to start your life as a new mom, that next chapter in your life, having to recover from that episiotomy. So thank you for reporting on that. I want to go back to tying into breastfeeding. Your ratings show breast milk feeding rates 12% higher compared with maternity care hospitals not recognized. So like you mentioned, you're tracking that. 12% is huge. These hospitals are 13% more likely to report race ethnicity for both C-sections and the severe unexpected newborn complications compared to the ones not recognized. And then this bullet point had only 160 hospitals of the 414 that were identified with a non-white newborn population that was comparable to or higher than the non-white population of young children in the surrounding communities. Tell me about that.
Yeah, so we're not using this representation measure as part of our overall composite score, but it is an indication of how well the hospital's patient population reflects that of the larger community. And so this is another important metric of if a hospital is doing well on all of these metrics, but they're serving a patient population that isn't really representative of their community, they could really be doing a better job of making sure that they are serving their community at large. And so it's another quality metric that we publish on our website for the public and for the hospitals themselves to know how they're doing in serving their local community.
Absolutely. And the public wants to know this. Women want to know this. They want to know, this is my community. I live in a big city. We have a dozen hospitals here. We have a lot of choices. It might be dictated by your insurance, but if I were of a certain race or ethnicity, I would want to know where am I going to have my best odds, have best outcomes. And sharing this data, I haven't seen it published anywhere else. I don't know if you have. So again, thank you for digging into this and reporting on it. We have a lot of statistics about these maternity care access hospitals that we already talked about. The designation was awarded to 118 for these 2025 ratings. Some notes to point out, 75 hospitals were recognized as both, which you mentioned. So that's really powerful to me. It's a start, 75. Let's continue to grow that number. Any advice for these hospitals if they're interested, they're out there, community hospital, who would they contact? What would they need to do to be part of this study?
Absolutely. Hospitals that have not participated in the past can always email us, the team at maternity@usnews.com, and we would love to include more, especially of these access hospitals that are serving these more remote communities in our survey to be able to promote and provide information to the public about the services that they are providing.
Perfect. So please, everyone that's listening, if you work at one of these community access hospitals, please go ahead and email, and let's get on your list for 2026. On average, maternity care access hospitals are over 16 miles further from another maternity hospital than hospitals that are not. Okay, so 16 miles, that's the number we're looking for. You know, as a pharmacist, I like my data, my numbers. Yeah, you're a data analyst. And I always thought it was by county, but it's actually by distance is what we're looking for.
So we use both sort of in recognition of counties on the East Coast are pretty small. So being the only hospital in a county may mean something different than it means in Idaho, where counties are huge. And so we sort of use an either or criteria that a hospital either needs to be the only hospital within their county or the only hospital within a 15-mile radius, which is more trying to keep it fair across the country.
Fantastic. And that's where your education as a data scientist, you know, how do we keep these consistent across the measures around the U.S., which is quite diverse, not just in population, but in design as well. Most maternity care access hospitals are located in the South, so you had 38%, or Midwest, 30%. So that actually really surprised me. I know the Southeast is on our news a lot as far as maternal care because of political changes, you know, and laws that are changing over in that part of the country. But you just mentioned, like, you know, the Northwest, even we know Texas, right, has these access hospitals, these counties that are distance without maternity support as well, without obstetricians local to them. So very interesting. The South and the Midwest were the most in your study. Maybe do you think that has to do with who's reporting on it at this point, or is that like go ahead.
Certainly that's part of it, but also if you refer back to the March of Dimes report, you can really see there's a huge swath through the Midwest of counties that don't have access to any sort of provider at all. So that's really, it's hard to see sort of, or it's discouraging to see how many parts throughout the United States, and a lot of them are in the Midwest, that don't have access to the maternity care that they need.
Unfortunately, and I had a brief conversation with you prior to us hopping on for the interview, but just having spoken to so many obstetricians and maternal fetal medicine specialists in the U.S. and learning what it takes to become one, the number of years of schooling. Everyone listening knows the cost of education in the United States is just becoming unaffordable. And when you choose to go to that path, as passionate as you are about it, you're now delaying starting your own families, or you're having to deal with labor or pregnancy while you're in med school or on a fellowship or residency or board certification, and balancing both is extremely difficult. So I'm afraid, unfortunately, we're going to have more of these desert areas moving forward in the U.S. So unless we can bring the cost of education down and we can make laws equitable, for
Yeah.
everybody. That's what we have to do. Otherwise, we're going to be seeing more of them. So that is why I wanted to bring you on to share this data, because I really honestly, truly believe pharmacists are that missing link because we're the most accessible healthcare provider. Unfortunately, pharmacies are going through the same
Yeah.
outcomes is deserts. And just last month, there was a report put out how many are closing in small communities around the United States. And they're not going to have a retail pharmacy nearby, and they're not going to have a pharmacist that they know that knows their family and knows their medical history. So, we'll be stepping more into, I think, virtual care. But when it comes to pregnancy and you need that physical exam to make sure everything's good, you need that early care that's often missing in maternal health care. And now we have a whole journey of moms, what it takes to become pregnant for so many women. And then recovering from pregnancy is a whole other journey, another chapter in itself while you're trying to raise that baby. And we want to get the best health care to every female, male, whatever you identify, family in the United States to have these best outcomes and turn these numbers around. Is there anything else you'd like to add? Otherwise, I have 2 more questions for you.
We're just really excited to be able to provide this information to patients. And we would love to continue, as we continue to grow the program, we would love to have more and more hospitals participate so that we can provide information to more consumers and patients throughout the country about the hospitals and the maternity care available in their area.
Perfect. So one of my questions is, like, as a patient, and I guess a 2-part, as a pharmacist, you did already answer this. What can we do? It's different perspectives, right? But if there's no hospital on your list that's near me, who would I want to talk to in the hospital? Is there a certain titles and leadership, or do you talk to your insurance companies, or where would you go just to say, hey, can you participate? Email US News.
What I can say that we often work with, usually there's a quality improvement team or some sort of quality metric measure at the hospital that keeps track of these things, and they often are familiar with us, and they're often who we work with to help collect these data and keep track of everything as they submit the survey.
Perfect. Quality improvement. That's the key phrase. It might be different at each hospital, but that is where you want to begin. Ask that operator. Do you have a quality improvement? Who runs that department or that team? And get this data going from all the hospitals around the U.S. And let's improve these statistics so there isn't such a disparity between the ones that were rated and the ones that were not. And get the information, the ones that aren't even participating. And then I just have an off-the-wall question for you, because what you do, I think, is so important. And I think moving forward, statistics, it's interesting. People either love statistics or hate statistics. As a student in the real world, they're vital. And your work is incredibly important. Like I mentioned, I started by saying that I have these women from around the country reaching out to me going, I wasn't believed, I wasn't listened to in my pregnancy. If you listen to my previous interviews, you'll hear real stories from women who just had poor outcomes because they weren't listened to. But yet, we have these phenomenal practitioners out there, and I'm bridging that gap, right? How would a pharmacist or somebody who's a student right now in school get into a field like that you do with healthcare and statistics? Because it's such an incredibly important area, but it's very niche. And I know somebody's going to ask me this.
I think a lot of universities have excellent statistics programs, and a lot of educational programs include some statistics classes or ways that you can incorporate statistics into coursework in public health or biostatistics or epidemiology or a lot of those disciplines where you are studying public health outcomes.
And I have one more question I just have to ask. What is medical geography? Because this is a phrase I have not heard before.
Yeah, they don't operate at every university, but it is looking at how where you live affects your health outcomes. So it really fits really well with what we work on at US News. And so I'm really happy that I've been able to carry that forward into the work that we do here.
So to see the full data, go to health.usnews.com. And I want to share, if anyone listening enjoyed this episode, please subscribe, share, and help us spread the word so that we can make a difference in maternal health care all over the US, all over the world, because we see that a lot of things that are started in one country then becomes a standard in another. And we know we can only go up and improve from here. Jennifer, Winston, thank you so much for all your hard work doing this data, pulling these statistics, the biostatistics, the medical geography, so we know that women, wherever you are in the United States, how your area is standing when it comes to maternal health care and where you need to go. And you just set the bar really high by finding these top hospitals and publishing on it. Thank you so much.
Thank you.